Swayam Prabha. Digital India. Educated India.
Hello everybody. So I am Dr. Pushpalata K, Professor and HOD of Anatomy, JSS Medical College, JSS Academy of Higher Education and Research, Mysore. So today we will discuss about the midbrain anatomy. Okay. Why studying the gross anatomy of midbrain is important. So today's session we will discuss the midbrain. So we will discuss about the gross anatomy of the midbrain. Okay. Why do we need to study the midbrain anatomy? So here is an history. A 50-year-old female presented with sudden onset of left hemiplegia with double vision and right squint. Okay, so after this session, we will understand the anatomical basis of this signs and symptoms of this patient. Okay, learning objective for this session is describe the external features of midbrain, describe the internal features of midbrain at the level of superior and inferior colliculus, describe the connections of midbrain and describe the blood supply of midbrain, describe the clinical anatomy of midbrain and discuss and describe the anatomical basis and effects of Benedict's and Weber's syndrome. What is the need to learn this midbrain is? Okay, the midbrain serves as an important transporting and functioning center for motor and sensory activity, particularly the movements of the eye in synchronizing with auditory and visual impulses. That is, when somebody hears, you turn your head and see. So, that is this coordination of the head, neck movements with the eye and ear activity. So, this coordination takes place in the midbrain. Okay. So, the midbrain, it connects the forebrain with the hindbrain. Okay. The cavity of this midbrain is the cerebral aqueduct. Okay. So, this midbrain lies in the infratentorial part, okay, and this is connected with the cerebellum through the superior cerebellar peduncles, okay, and it extends from the posterior commissure of the third ventricle to the superior medullary velum, okay, and this aqueduct connects the third ventricle with the fourth ventricle. Okay, so this is the midbrain, and the cerebral aqueduct acts as a line of demarcation, because anteriorly it is called the peduncles and posteriorly this is called as the tectum. Now, coming to the anterior view, how we see, what are the features we see in the anterior or the ventral aspect. So, you can see there is two large bundles of fibers called as a cerebral peduncles. They are separated by a deep fissure, okay, and you can see, appreciate here, the deep fissure is narrow near the pons, okay, and it widens as it is diverging and enter into the cerebral hemispheres, okay, and this this crus cerebri or the cerebral peduncles forms a posterolateral boundary of this interpeduncular fossa. So, this interpeduncular fossa is a space in the base of the brain. So, this forms the posterolateral boundary, and we can appreciate here on the medial aspect of this peduncles, there is oculomotor nerve emerges, and on the lateral aspect the trochlear nerve is emerging. Okay. So, here you can appreciate, so this is the crus cerebri. Okay, so this crus cerebri is crossed from above downwards. You can appreciate here is the optic tract and there will be basal vein, then posterior cerebral artery and superior cerebellar artery. Okay, so between this posterior cerebral artery and superior cerebellar artery, we can appreciate the oculomotor nerve and the laterally trochlear nerve coming out. Okay, so the same thing when you see on the posterior aspect, okay, you can see the two pairs of elevation. Okay, so that is the superior colliculus and inferior colliculus separated by a cruciform sulcus. Okay, and this superior colliculus is connected to the lateral geniculate body through the superior brachium, and inferior colliculus is connected to the medial geniculate body through the inferior brachium. Okay, so and we can appreciate the trochlear nerve winds around to reach the ventral aspect. So, this is the only cranial nerve which is coming from the dorsal aspect of the brain. Okay, then it reaches the ventral aspect. Now, let us see. So, we have studied the gross anatomy, the external features. Now, let us study once we cut the structures what we see. Okay, as I said, the anteriorly. Okay, this is called as a cerebral peduncles. You can appreciate here in the brain here, and the posterior to the cerebral aqueduct is the tectum. Again, this cerebral peduncle is divided into anterior part is the crus cerebri. So, this crus cerebri is the one which continues as the basilar part of the pons and the pyramid. Okay. So, then dorsal to that what we see, there is a darkened area. Okay. So, the pigmented area, it is called as a substantia nigra. Okay. Then dorsal to that what we see is the tegmentum. Okay. And posterior to the aqueduct is the tectum. So, from anterior to posterior, when we see the internally, when you cut the section of the midbrain, you see anteriorly it is the crus cerebri, substantia nigra, tegmentum and tectum. Okay. Now, let us see what is the structures which is there in the crus cerebri. Okay. So, the crus cerebri, the lateral 1/6, okay, this part is the temporopontine fibers are running through this part, and the medial 1/6 we see the frontopontine fibers. Okay. So, here in the lateral is the temporopontine and medial is the frontopontine fibers, whereas the middle 2/3, okay, you see there is a corticospinal and corticobulbar fibers. So, this corticospinal fibers is the one which runs in the basilar part of the pons as well as it goes into the pyramid. This corticobulbar fibers, they enter into the midbrain from the internal capsule, that is through the genu of the internal capsule, then it enters the middle part of the crus cerebri of the midbrain. Here the fibers are arranged. Okay. So, here the head, the fibers which are coming from the head are most medial and those for the leg are the most lateral one. So, head medially and the leg laterally. So, according to these fibers are arranged. Next, coming to the substantia nigra. Okay, so as we can see, this is the darkly the pigmented area. So, it contains the pigmented sheet of nerve cells. Okay, and this is extending from the cranial border of the pons to the subthalamic region. Okay, and here you can see the ventrally there is a serrated, okay, that is projects into the crus cerebri. Okay, and here the ventral part, it is very less pigmented and it is called as a pars reticularis. This is made up of a large multipolar neurons. Okay, and this is the which receives, the reticularis is the one which receives the information, and this is rich in iron. Okay, whereas the posterior part, okay, it is the dorsal pigmented and very compactly arranged, that is called as the pars compacta. Here the dopamine is secreted mainly in this region and it is made up of a medium sized and the small multipolar neurons, and this is the sole output is from the this compacta. Okay. So, this is the substantia nigra. Now, let us see what is the importance to learn this connections of the substantia nigra. So, this substantia nigra is connected with the corpus striatum, okay, and the thalamus. So, this connection that is between the substantia nigra, corpus striatum and thalamus, okay. So, they help in the smooth and skillful performance of a volitional act, okay. So, this is for the skillful performance of the act, this connection is necessary. Okay, that is the nigrostrial fibers, they inhibit and prevents the tremors here. Whereas the strio-nigral fibers, they inhibit the neurotransmission in the substantia nigra. And the dopamine which is produced here in the, this is from the substantia nigra, goes to the striatum. Okay. So, what happens if there is any, this dopamine is reduced here, then the patient can come with a Parkinson tremors. Okay. So, that is why this substantia nigra is very, very important. That is connected between the substantia nigra, striatum and thalamus is very, very important. Okay. So, now, so till now what we have studied is the midbrain. Okay. It is has the dorsal surface and the ventral surface. It connects between the the forebrain and the hindbrain. Okay. And here you can see it forms a posterolateral boundary of the interpeduncular fossa. Okay. And here you can see that oculomotor nerve emerges from the medial aspect and trochlear nerve is from the lateral aspect. Okay. And in the cut section from anterior to posterior, we can appreciate the crus cerebri, substantia nigra, tegmentum and tectum. And the cavity of the midbrain is the cerebral aqueduct. Okay. Here in the crus cerebri, the lateral most is the temporopontine fibers, middle 2/3 is the corticospinal and corticobulbar fibers, medial 1/6 is the frontopontine fibers. Now, let us see. So, we have studied the crus cerebri and substantia nigra. Let us see what is the structures at the tegmentum. Okay. So, there is a two levels, one is at the inferior colliculus, one is at the superior colliculus. Now, at the inferior colliculus, so what are the structures we see here is, one is the, here you can see in the periaqueductal grey matter, in the anterior aspect you can see the nucleus of the trochlear nerve. Okay. And in the lateral aspect you can appreciate the mesencephalic nucleus of the trigeminal nerve. So, this mesencephalic nucleus of the trigeminal nerve is it carries the proprioceptive sensation. Okay. And the trochlear nerve is the only nerve, okay, the only cranial nerve which is crossing over and coming from the dorsal aspect. Okay. All the other cranial nerves are ipsilateral, only this is contralateral which crosses over. Okay. And we can appreciate the nucleus of the inferior colliculus. Okay. So, this inferior colliculus is for the hearing. So, now the white matter. So, just dorsal to the substantia nigra, you can appreciate the whatever the fibers which are coming from the pons, that is the medial lemniscus, trigeminal lemniscus, then spinal lemniscus and lateral lemniscus. This medial lemniscus carries the fibers from the nucleus gracilis and cuneatus. So, in the medulla it is oriented sagittally as it is coming through the pons and the midbrain. So, they are sagittally oriented. The cuneatus fibers are medial and the gracilis fibers are lateral. And the lateral to that we see the trigeminal lemniscus from the trigeminal nerve. Spinal lemniscus is the continuation of the lateral spinothalamic tract and the lateral lemniscus is a continuation of the auditory pathway. You can see here it is ending at the inferior colliculus. Okay. Then here in the median region we can appreciate the decussation of superior cerebellar peduncles. Okay. So, this you can see the superior cerebellar peduncles, the ascending fibers from here goes to the thalamus and the descending fibers goes to the reticular formation in the pons and the medulla. Okay. In the median region, just in front of the central grey matter, you can appreciate the medial longitudinal fascicles. So, that carries the fibers from the vestibular nuclei, then the tectospinal fibers and rubrospinal tract. Okay. So, this is the median region. Okay. Now, let us see what are the structures at the tegmentum at the superior colliculus level. Okay. So, here in the superior colliculus level, we see the nucleus of the oculomotor nerve. Okay, and the lateral, the periaqueductal grey matter, we can appreciate the mesencephalic nucleus of the trigeminal nerve, and there is an appearance of the red nucleus at the superior colliculus level. Okay, and we see there is a just in front of the superior colliculus, we can appreciate the pretectal nucleus. So, this nucleus is important for the pupillary light reflex. Now, coming to the white matter at the superior colliculus level. So, the same which continues here, that is the in front of the substantia nigra, there is a red nucleus, and lateral to that we appreciate there is a medial lemniscus, trigeminal and spinal. So, the lateral is already disappeared with the inferior colliculus level. Here we see only the 3 lemniscus. Okay, and in the center, we can appreciate there is the ventral and dorsal tegmental decussation. This ventral decussation of foral, okay, it is the decussation of the rubrospinal tract, and the dorsal decussation of Maynard is the decussation from the tectospinal tract, that is from the superior colliculus. So, these are the we see ventral and dorsal decussation. Okay, and here you can see there is a reticular formation is seen here. Okay, so this is the what are the white matters what we appreciate at the level of the superior colliculus. Now, let us see the what is this red nucleus. Okay, why is this red? It is called as a red. Okay, it is almost 5 millimeter. Okay, and it is present at the tegmentum just dorsal to the substantia nigra. This is appears little pink or red in the section. This is because it is rich in iron. Okay, and this has got a 2 parts. One is the caudal part, it is a magnocellular part, and this little older, and it has a multipolar neurons. Okay, and the superior or the rostral, it has got a parvocellular part. It is recent in appearance and is made up of small neurons. Okay, and why studying this red nucleus is important is it forms the important nucleus of extrapyramidal system. Okay, and this has a main influence of the flexor muscles, and also this helps or monitors the cerebellar function on motor system. Now, what is the connection of the red nucleus? Okay, so then red nucleus is afferents are from the cerebral cortex, that is the motor area 4 and 6. Okay, and from bilaterally it receives, and from the cerebellum through the from the cerebellum you can see that the dentate nucleus and the globus is also it receives, but it is from the contralateral side. Okay, so from the cerebellum it is a contralateral side. Also it receives the fibers from the corpus striatum, okay, and the tectum. But whereas the efferents it is got connected with the this efferents they form the ventral tegmental decussation what we observed in the previous slide. Okay, so they go to the spinal cord. Okay, that is the again it is a contralateral because they are the output fibers or the efferents one they decussate and go to the spinal cord contralateral side, and also to the cranial nerves 3, 4, 5, 6 and 7. And also to the inferior olivary nucleus, and also to the reticular formation, and also it goes to the thalamus. So, it is connected with the cortex, cerebellum, thalamus, the striatum, okay, and also spinal cord. So, you can observe that it is connected with most of the parts of the brain. And here you can appreciate here that is it receives the information from the cerebellum via the cerebello-rubral fibers, and it sends inhibitory impulses to the ipsilateral olivary nucleus. Okay, so this is considered as a relay station and helps to maintain the harmony in the execution of the movements. Okay, and this is the rubrospinal tract. Okay, so this is essential for controlling the motor activity. It is largely the crossed fibers. It is present in the lateral gray column of the spinal cord. Okay, and it is terminates on the interneurons in the spinal cord. This controls the distal limb muscles. It stimulates the flexors and inhibits the extensor. So that is why studying the red nucleus with its connection is important. Now, till now what we have studied is the midbrain has a dorsal surface, okay, and the ventral surface. In the ventral surface, you can see appreciate the crus cerebri on each side. Okay, on the medial aspect, the trochlear nerve is emerging, and from the lateral part, from the medial part is the oculomotor nerve, and from the lateral part, the trochlear nerve is emerging, and you can see there is a groove which is narrow near the pons. As it is diverging entering into the cerebellum, this widens. Okay, and in the cut section we can observe from ventral to dorsal the crus cerebri, substantia nigra, tegmentum and tectum. Okay, and here at the crus cerebri, lateral fibers are the temporopontine fibers, medial most are the frontopontine fibers, in the middle is the corticospinal and corticobulbar spine fibers. Okay, and here at the level of the inferior colliculus, okay, so we can appreciate in dorsal to the substantia nigra, the 4 lemniscus are arranged coronally. Okay, and in the center you see decussation of a superior cerebellar peduncles. Okay, and in the grey matter what we see, there is the nucleus of the trochlear nerve. Okay, and the mesencephalic nucleus of the trigeminal nerve, and we can see the trochlear nerve emerging and crossing over the dorsal aspect. And at the level of the superior colliculus, okay, so the lateral lemniscus is not seen, the other 3 lemniscus are seen, because the lateral is, you can see it is ending near the inferior colliculus, and here you appreciate the nucleus of the oculomotor nerve and the mesencephalic nucleus of the trigeminal nerve and pretectal nucleus. So this is for the pupillary light reflex, and in the center we can appreciate the decussation, the ventral and dorsal decussation of the tegmentum we can appreciate. So now we have studied the crus cerebri, substantia nigra and tegmentum. Let us see what we see at the tectum. Okay, so this tectum is just posterior to the cerebral aqueduct. Here we appreciate the quadrigeminal body, that is the 2 pairs of colliculus, superior and inferior, separated by the cruciform sulcus. Okay, and this is derived from the dorsal lamina of pre-aqueductal grey matter. Okay, so now let us see what are the connections of the inferior colliculus. Okay, so this is a inferior colliculus is an important relay station in auditory pathway. Okay, it is connected to the superior colliculus. So this is very important because this connection is the where it helps in turning the head and eye towards the source of sound. So that is this connection between the superior and inferior colliculus is very important. Okay, and also it is connected to the opposite inferior colliculus through the commissural fibers, and it is connected to the nucleus of lateral lemniscus through the lateral lemniscus. It is also connected to the superior olivary nucleus, and fibers from the inferior colliculus through the inferior brachium connected to the medial geniculate body. From here it goes to the auditory cortex. Okay, so this connection of inferior colliculus is very important because this is the main pathway in the auditory system. Now let us see what is the importance of the superior colliculus. As we know, this is the superior colliculus is concerned with the visual reflexes. Okay, so this it receives the communication from the retina. Again, this helps in turning the head and eye towards the source of light and also closure of the eye. So this connection is from that is the retina is very important. Okay, and this is connected to the lateral geniculate body through the superior brachium. Okay, and also it is connected, the superior colliculus is connected with the visual cortex. Okay, that is to the, and from there it is to the superior colliculus, then through the tectospinal and tectobulbar connection. Okay, so this is helps the where it is connected with the 3rd, 4th, 6th and the 11th cranial nerves. So this is very important because it helps in the accommodation to the near objects with the reflex movements of the head and eye in a scanning movement. So as soon as you see something, you will scan. So this connection is very important for that. Okay, and also it is connected to the brainstem, that is to the, and also to the cerebellum. Also it is connected to the inferior colliculus and to the opposite superior colliculus. As I said, there is a connection between the superior and inferior colliculus is very important, because to turn the head and see towards the sound and towards the right reflex, and connection with the cranial nerves, again it makes a very important for the coordination of the movement. So now we have studied what are the important grey matter and the white matter. Okay, so now let us see what is the blood supply to the midbrain. Okay, so it mainly receives, okay, from the basilar artery through the posterior cerebral artery, then the superior cerebellar artery, okay, and the posterior communicating artery and the choroidal arteries, the anterior choroidal artery. So these are the four main arteries that is from the basilar artery supplies. Okay. So here we can appreciate the, again it is divided into median territory, that is the paramedian branches of the posterior cerebral artery which supplies. Okay, so this area is, that is the paramedian region, is supplied by the branches of the posterior cerebral artery. So what are the structures here present is the red nucleus, the medial part of the substantia nigra and the medial part of the crest cerebri. So to know this, which is the area and what are the structures present, helps us to locate the lesion if any patients comes with a history of involvement of these structures. Okay, so this is the area where it is affected if this artery is damaged. Okay. Next, the lateral territory. So this area, the lateral territory, is by the quadrigeminal artery of the posterior cerebral artery. So here is the posterior cerebral artery. So this gives a branch, that is the quadrigeminal artery. So this supplies the lateral area. So what are the structures come across here is the both the superior and inferior colliculus, then the periaqueductal grey matter. Okay, then there is a medial lemniscus and the lateral part of the substantia nigra and the lateral part of the crest cerebri. So this is the lateral territory. Okay, then there is a superior cerebellar artery. Okay, so this is the superior cerebellar artery. Okay, so this again also supplies the superior and inferior colliculus. Okay, so the venous drainage from the midbrain mainly goes into the cerebral and basal veins. This is the blood supply. Now, why this clinically it is important to study the midbrain? So we have studied there are so many nucleus, so many connections. Okay, and this is the most commonly involved in the traumatic injury. Why? Because it is the one which ascends through the small rigid opening in the tentorium cerebelli, and it is more vulnerable to the traumatic injury, and also it is more common site for tumors, hemorrhage or infarcts. And also if there is any blockage of the cerebral aqueduct, again that leads to pathology into the midbrain. Okay. So here we can appreciate, here there is the called as a Weber's syndrome. So what happens in this Weber's syndrome is, so there is occlusion of the posterior cerebral artery. So what happens if the posterior cerebral artery is occluded? Okay. So here because this it supplies the paramedian region, right. So there is an alternating oculomotor hemiplegia. So why it is affected? Because you can see there is oculomotor nerve is emerging at this place. So and also the crest cerebri is affected. So there is contralateral hemiplegia and the contralateral face and tongue due to damage to the crus cerebri, and ipsilateral deficits in the eye motor activity and pupil dilatation. That is because involvement of the oculomotor nerve and pyramidal, the crus cerebri involvement. So, this is called as a Weber's syndrome. So, here mainly affected is the posterior cerebral artery, the branches is affected, and that is leading to these symptoms and leads to Weber's syndrome. Another syndrome is the Benedict syndrome, where there is a necrosis, okay, it's involving the medial lemniscus and the red nucleus. You can appreciate here where it is, there is a necrosis involving the medial lemniscus and the red nucleus, okay. So, what happens if this is damaged? So, this causes a ipsilateral, again you can see the third nerve is coming out. So, ipsilateral third nerve lesions and pupil dilatation, contralateral tremor, chorea and athetosis. Okay. So, this leads to a syndrome called as the Benedict's syndrome. Okay. And so, here there is a, you can appreciate the rubral tremor. It is a coarse tremor in the upper extremity when the person is at rest, okay, postural or in tension. So, the tremor at the rest or any posture or in the intentional, okay. Then the Claude syndrome is where the ipsilateral third nerve, contralateral tremor, ataxia and there is a incoordination, okay, that is called as a Claude syndrome. Okay, and the Perinaud syndrome where the lesion is at the superior colliculi due to the compression by the pineal gland tumor. Okay, so here what happens? There is a weakness of the upward gaze and vertical nystagmus. So we know at the superior colliculi again it is the third nerve is damaged. Okay, so now let us discuss what is this case what we have studied at the beginning of this session. A 50-year-old female presented with a sudden onset of left hemiplegia with double vision and squint, right squint. Okay, you know the left hemiplegia is mainly because of the involvement of the corticospinal tract, double vision mainly because of the superior obliques, that is superior oblique means at the level of the inferior colliculus, and the right squint. So, that is why the studying the anatomy of the midbrain helps to localize the lesion. Okay. So, now to summarize, so we have studied the midbrain external features. Okay. So, in the ventral aspect you can appreciate the crus cerebri, okay, and they are diverging from the pons towards the cerebellum and it forms a boundary of the interpeduncular fossa. Medial aspect you can appreciate the oculomotor nerve, and the lateral aspect you can see the trochlear nerve. Okay. And the cut section you can see in the anteriorly it is the basis pedunculi, okay, and posteriorly is the tectum. Okay. Here you have there is a crus cerebri, substantia nigra, tegmentum and tectum. Okay. Then at the level of the inferior colliculus we can appreciate dorsal to the substantia nigra, medial, trigeminal, spinal and lateral lemniscus, and in the periaqueductal grey matter we can appreciate the nucleus of the trochlear nerve, mesencephalic nucleus, okay, and in the ventral aspect of the median region we can see the decussation of the superior cerebellar peduncles. Anterior to that we can see the rubrospinal tract, posterior to that we can appreciate the medial longitudinal fasciculus and tectospinal tract, and we can also appreciate on the lateral aspect the reticular formation. And the trochlear nerve is the only cranial nerve which comes from the dorsal aspect and crosses over, goes to the contralateral side. Okay. Now at the superior colliculus level, okay, so we can appreciate the three lemniscus, that is the medial, trigeminal and spinal. There is appearance of the red nucleus, okay, and the ventral and dorsal decussation of the tegmental decussation is appreciated. In the center grey matter you can appreciate the oculomotor nerve nucleus, okay, and the mesencephalic nucleus of the trigeminal nerve, and appearance the pretectal nucleus, that is for the pupillary light reflex, and we can appreciate the superior colliculus. Okay, and the main blood supply to the midbrain is by the branches of the basilar artery, that is the posterior cerebral artery, posterior communicating artery, then the superior cerebellar artery. So, these are the 3 main arteries which supplies along with the anterior choroidal artery. Thank you.